Welcome to Greenfield Community College's Survey of Health Careers. I'm Lou Pugh, and I'm here today with Mary Ellen Burke. Welcome, Mary Ellen.
Hi.
Mary Ellen is part of our nursing faculty for the Associate Degree of Nursing, and she's here to talk about her career. I'm wondering if you would be willing to start with your educational background and what drew you to nursing.
Sure. My educational background, well, I'm from New Jersey, so I was attending Rutgers University, Douglas College, which is a women's college, and I was an English major, English journalism major, and which I liked very much, but I was wondering what I was going to do for a job with that. So I actually was pretty young, and I happened upon walked into the nursing department by accident one day and talked to the director there, and she kind of talked me into applying to the nursing program. And so I did, and I got my bachelor's degree from Rutgers College of Nursing in 1988, I think. Yep.
Mm-hmm. And then did you practice as a nurse before you went back for your master's?
I did. When I graduated, I worked in St. Peter's Medical Center, which is a large medical center in New Brunswick. I was a labor and delivery nurse, so I worked in labor and delivery there for about a year and a half. And then I moved to Georgia, and I worked down in Athens, Georgia, in labor and delivery down there. And then we moved to Virginia. We moved around a lot, so I worked there as well.
Mm-hmm. What made you decide to go back for a graduate degree to go into midwifery versus being a labor and delivery nurse?
I was actually interested in being a midwife after my OB rotation in nursing school because I loved it so much. So it was always in the back of my mind that that was something I'd like to do someday. And then also, you know, when you're a labor and delivery nurse, you do a lot, you spend a lot of time with the patient. You're with them during the whole labor, and then of course somebody else comes in and catches the baby. And so it's kind of a little less satisfying. So I really wanted to be totally a part of that. So it was always in the back of my mind to go back to school, and when an opportunity presented itself, then I decided to go back.
What kind of continuing education do you need to maintain your license as a midwife?
I need to, my certification renews every 8 years, although they're going to reduce it to every 4 years. And in that period of time, you have to do 20 hours of continuing education. Well, CEUs, which adds up to a little bit more than hours. It's 2.0 CEUs. It's 20 hours of education in the related field, so in midwifery or women's health. So you have to do that, and then you also have to do modules that they send you. You can send away for in the mail, and you read articles, and then you take a test and you send it into them. So you have to do modules for women's health, prenatal, labor and delivery, and newborn and gynecological care. So you have to do that, and then once you complete that, you send in all that documentation, and they send you your new certificate.
I'm going to shift gears a little bit. Do you use complementary medicine in your practice as a midwife?
Oh, absolutely.
Do you want to give some examples?
Sure. In terms of, I mean, it can run the gamut from perhaps using something like evening primrose oil for towards the end of the pregnancy to help with cervical ripening. In terms of nutritional supplements, you can use herbal teas. Instead of perhaps an iron supplement, you can do alfalfa tea or alfalfa supplements, which are really high in iron and calcium. So we use a lot of different complementary things, even, you know, massage and visualization and breathing, and so it really runs the gamut.
So How do you balance your teaching and then your clinical practice? Are you able to maintain both, or are you only teaching at this point?
At this point, I'm only teaching. When I started here at GCC, I was a clinical instructor in maternity, and I worked per diem at a local community health clinic. So I was able to do that for a while, but as I got more involved here at GCC, it started to take up more of my time. So, you know, I really liked it. So when I came here full time, so I'm no longer regularly clinically practicing, but I still get to do what I consider clinical practice, you know, with going into clinical with the nursing students, and I sort of feel like I midwife the nursing students.
Yeah. Let's see. Would you feel comfortable sharing a story about a patient or a family that you've worked with that touched you in some way?
Sure. Let me think about in particular. You know, I think practically, you know, most families, you know, it's an honor to be present at the birth of their child. So I can think of lots and lots of instances. I know, I can remember when I was in midwifery school, you know, I was learning to catch babies, and it's quite a responsibility, so it's kind of scary. And if you've ever been a student in a clinical situation, and my nursing students could probably relate to this, you're very nervous, you want to do everything right, but you're not sure. So I was with a young girl in labor who was probably 16 or 17 years old, and she had the same name as me, so that was kind of nice. And so I was coaching her, and at one point my preceptor, who was another midwife, was in the room, so she started to also talk to her when she was getting close to delivering, and she said that I was the only one in the room allowed to talk. That was the only voice she wanted to hear. So that felt really good, because apparently my voice was comforting her. And so it made me feel like, oh, I really am, you know, doing a good job here, because she feels like I'm helping her.
Yeah.
So that was really memorable.
You must run into some very difficult situations also.
Yes, I mean, people think of maternity as being all happy, and most of the time it is, but sometimes, you know, there are losses that can be extremely devastating for a family. Also, there are emergencies where you have minutes to act to save a mother or a baby's life. Things that come to mind are, you know, when women have extremely high blood pressure, they can start to have a seizure. And so that's really frightening, but it's also frightening because the baby gets deprived of oxygen. So you have to control this woman who is having a seizure, but at the same time you have to keep track of that baby, and you may have about 4 minutes to get a baby out who is not getting enough oxygen. So obviously that woman, you know, would need a C-section if the baby was in fetal distress. So sometimes it's, you know, it can be very routine, but then it can be very scary. Sometimes it can be, you know, hours of boredom interspersed with moments of terror.
Yeah.
So.
And when you were in school for midwifery, was there a special section on loss, grieving, dealing with the death of an infant, for example? Or is that something that you learned after you started practicing on your own?
I think I learned a lot of that from being a nurse in labor and delivery. Almost just about every place I worked had a particular special program in place for people that lost babies, either through miscarriage or stillbirth. They had specific programs in place, specific things the nurses would do. You would put something special on the person's door so that people weren't coming, you know, the dietary people wouldn't be coming in saying, oh, congratulations, so they would know that there was a loss. We would take pictures and offer them to the parents, but if the parents didn't want to see them, you know, we would hold on to them in case later, at a later time, we would have volunteers often would knit little blankets and outfits for the babies. And so we would dress the babies, and we would make, take a nice picture. We would get a lock of hair, a footprint, so they would have a memory book, so that we would offer to the parents or hold for them, because sometimes they're not ready to see those. So we just hold on to them, and oftentimes later they want those things.
So what advice would you have for students who are beginning or are in the midst of their academic studies and are thinking about nursing, and in particular either labor and delivery or midwifery?
Well, I think first of all, if you're in the beginning and you want to go the route to nurse midwifery, you need to go to nursing school first. So be very strong in your sciences, take a lot of science. Brush up on your mathematics, because that always comes in handy. And then once you're in nursing school, do well in nursing school, because for graduate school you usually need to have fairly good grades, usually at least a 3.0 or higher to get into graduate school. And oftentimes midwifery programs sometimes want you to have some experience in maternity or labor and delivery. It's not always a prerequisite, but if that's the area you're interested in, that's the area you should work towards. Sometimes you may not get into labor and delivery right away, but you can start in one area and then look for an opportunity to work in that area eventually.
So have you delivered babies at home?
Well, when I lived in Virginia, I did do some private labor assisting with a direct entry midwife. I didn't deliver them myself. I did assist in a couple of them, and so that was kind of interesting. And 2 of my own babies were born at home, but I was attended by another nurse. I didn't do it myself. I had a nurse midwife attend me.
And would you compare and contrast sort of the experience of a home birth versus a birthing center versus a traditional hospital, and from a clinical point of view?
In terms of that, there's such a wide variety. I think it's more a lot of it is the attendant. It depends on, in terms of home, it depends on, the qualifications, who's attending you. Is it a nurse midwife? Is it a direct entry midwife? Is it a lay midwife? There is a wide variety. Most nurse midwives actually deliver babies in the hospital. People hear midwife, they think everybody delivers babies at home, and that's really not always the case. And particularly most nurse midwives, particularly in this state, deliver babies in the hospital. Birth center is a home-like environment, but instead of someone going to the home, the mothers come to the birth center, but they try to make it a home-like environment. In safe home birth and birth center birth, there is emergency equipment, there is oxygen, suction, and a plan to transfer in an emergency. So women are screened so that only women who are low risk, both physically and emotionally, because particularly at home there's no pain medication offered, because that increases your risk, because it depresses the baby's respirations. So a woman has to be ready physically and emotionally to do that. So there is a screening process, and if at any time the woman becomes high risk, then they are transferred to the hospital, or if they decide this is not for them, they're transferred to the hospital. So I guess the birth center is kind of an extension of home birth, maybe a little bit between a hospital and at home. The hospital, it can range. There's a wide variety of experiences in the hospital, from very home-like to highly technical. So hospitals have a wide variety. Midwives have a wide variety of philosophies. There are midwives that are very low-tech. There are midwives that are very high-tech, and all in between. So there's not people have this one image of what a midwife is, and there's as many variations as there are variations in people.
Now, would you go back, you had mentioned the direct entry midwife. Can you explain how he or she would differ from a certified nurse midwife, or am I getting the terms wrong?
Direct entry midwives are midwives that usually train with an apprentice in an apprenticeship type model. It's not through necessarily a formal education program, although there is a mechanism for licensing of direct entry midwives in some states, or they do have some form of a certification that they can do, but it's not through a medical or nursing model that they get their certification. And in terms of legal issues surrounding that, there are different regulations depending on which state you live in.
Are there direct entry midwives practicing in Massachusetts?
Yes.
It's allowed in Massachusetts? Well,
no, I can answer that. There are direct entry midwives in Massachusetts. They are allowed to practice, except if you're an RN, oddly enough.
Okay.
It's kind of an old law that just was on the books like that. So.
Interesting. So I'm wondering if you've seen some trends in public health that have impacted nursing, the nursing field. For example, I'm thinking about, say, obesity or HIV/AIDS. How that might have impacted birthing.
In terms of the public health, I think a big issue has been substance abuse, and even beyond substance abuse, people who are in rehabilitation who may be taking methadone. Those babies are born addicted, so they have withdrawal problems, and so it seems like we're seeing a lot of that. So those babies have to be withdrawn slowly when they're born from the narcotic that they're addicted to. So typically they will give them morphine and then slowly decrease the dosage of it incrementally so that their system isn't too stressed from withdrawal. So I think that that is a big issue. The other thing in terms of childbirth that has changed is in the 70s and 80s, there was a big move towards natural childbirth. It was the big thing. Everybody went to Lamaze classes, everybody was doing breathing, and now it's almost gone in the opposite direction in that a majority of women in this country have epidural anesthesia for childbirth. So, there are pros and cons to that. And so, but it has been a change. And so I don't know if it's a good thing or a bad thing. Certainly it brings more technology into what is essentially a physiologic act. So who knows?
What, in terms of reflecting on your practice, and now that you're also faculty, what are some of your most favorite things about being a midwife, about being a teacher?
I think the thing that makes it different about being a midwife, I think it's a philosophy of looking at things that affects everything that you do. I think being a midwife makes me look at things more holistically, and makes me look at just beyond what is going on in someone on a physical level. We look at the person on the whole level. Midwives believe in empowering people, that they have the ability and the right to make their own decisions about how they want their health care experience to be. So I think we're more open to hearing people's point of views, so I think that has been helpful. And again, I said in terms of teaching, I think that midwifery doesn't just necessarily apply to delivering babies. I think I'm birthing nurses, and that sounds a little funny, but in terms of coaching them, it's essentially what you do, particularly in clinical. You don't want to jump in and do for them. You want them to discover on their own. You're kind of like kind of like the lifeguard.
Mhm.
And so you watch and you might let them struggle a little bit so that they can grow, but you don't let them get into trouble. So you're there in case there's a problem. Or if they get discouraged, you're there to coach them through it. So I think you can translate that philosophy into a lot of things, and particularly in teaching, bringing someone into a profession that is a big transition in a lot of ways.
Yeah. Well, I'd like to open it up for questions from the floor. Sure.
You talked about 3 different kinds of midwives. Can you kind of describe each one?
Sure. Well, you have nurse midwives, and those are people who become registered nurses first, and then either they go to a certification program or a graduate degree, master's degree program, and they, when they graduate from that, they take a national exam from the American College of Nurse Midwives, and they become a certified nurse midwife. The American College of Nurse Midwives has also recognized certified midwives now. So now you don't need to be a nurse first. So that's something new that is also recognized. So you go right from, I believe you have to have a bachelor's degree, and then you get a master's degree in midwifery. So you're a certified midwife. Those are the 2 types of midwives that are more hospital-based a lot of times, not always, but the majority. And then you have direct entry licensed midwives that might go to a direct entry program or apprentice with another midwife. And there is a certification exam, but it also might be informal. And those midwives mostly deliver babies outside the hospital, mostly at home. And then lay midwives are people that just decide to study on their own and or whatever and deliver babies. So, and those people obviously are also outside of the hospital.
Other questions? Sure.
I was wondering about when you spoke of loss of babies or unforeseen problems, how do you as a professional handle that?
Personally, you mean?
Yeah.
You know, I think that it is okay to grieve with the parents. In fact, they appreciate it. So in terms of dealing with the parents, you want to be compassionate, but oftentimes you'll shed tears also. And I never worry about that. I usually cry when babies are born too, for a different reason. And I think that that emotion is okay. And it's probably healthier than trying to just block how you feel in the moment on either end. And the parents appreciate that you are sharing that grief with them. So I don't try to just, steel myself. I don't feel anything or anything like that, no.
I have a question.
Yes.
Have you ever run into a male midwife?
Yes.
Yes.
There is a male midwife in this area. I believe he's further south. And so men can be midwives, and men can be wonderful midwives. In fact, I believe from what I've heard, this particular male midwife is wonderful. And so I know that it's been traditionally a profession of women, but certainly there are men, and I haven't had nursing students who loved maternity. And so they were surprised to find out that they could be a midwife. Absolutely.
Jan?
What is the source of the word midwife?
The
What does
word
it
midwife,
mean?
it means with woman.
With woman.
So you're with the woman at the time of birth or whatever. Midwives don't just deliver babies. We also do well woman care, primary care for women, and GYN care. So we can take care of women even before and after they're done having babies. Yeah.
So it's almost the name of the title is about patient, and it's not an identifier of you. Because I think people
Yes.
confuse it to think that it's somehow that, you know, yes, you are a midwife, but it's more about the name of the patient.
Yes, and you know, it's kind of reflective of the philosophy. It's not about me.
Right,
It's about them.
right.
Well, thank you very much for
Oh,
being here.
thank
This is
you.
great. Yeah.
Thank you.